Welcome, everyone. It is episode 9. We are here with the Health Inspired podcast. We are so excited to bring to the stage Laidy Martinez. This is our live episode. I wanted to do a special episode for this week, specifically on creating human connections. So, welcome to the show, Laidy. How are you doing?
I'm doing pretty good, Jennifer. Thanks for the invite. I'm very excited to be here in your podcast and then, just to kind of share with our friends.
Exactly. There's a lot of things going on in the industry. And so I want to catch up with you a little bit. What have you been up to lately? I know you've had a lot of changes in your professional life. How is that going with your new job?
It's coming along. Of course, it's something totally different than what I was doing, right? Like now I have more responsibilities, but I'm learning. It's a learning process. I'm enjoying it. I'm really enjoying being part of this new organization. So, of course, there's so many changes. I had to adapt myself to the AHR system, but I'm actually loving it. Like I feel like I'm getting very good support from my managers and the directors. So I'm having a good time. And I think October was my month, right? It's like I did so many things in October. I was like, my goodness. But once I was analyzing 4 of my 6 credentials that currently have, I passed them on October. So maybe October is really my month.
Excellent. That is so encouraging to hear what you have had going on and how much success you had. October is a great month. I'm not going to lie. It's one of my favorites because it's when fall really kicks off, at least for me.
Hmm.
And I get to, experience all the fall stuff. Like I was just looking outside my window today and I was just noticing how different fall is this year here in Arkansas for us. A lot of my trees that haven't historically become
It's
colorful,
beautiful.
it's
Hmm.
like the way that the rain hit at the right temperature, it just created this beautiful outpouring of
Oh
colors.
my God, that's a beautiful landscape. Yeah.
It's gorgeous. And I was like, I just really need to be appreciative of where I live. It's beautiful.
Yep.
The Ozarks are beautiful. I do miss California. So for those of you that don't know, Laidy is in Southern California, my home. It will always be my home. I will always be a SoCal girl. So I am missing it out there. I get to come back in April to see my family and of course to present an amazing session, hopefully there in Orange County for the modifier boot camp. So I'm really excited
Yes.
for that. Yes. So excited to come see y'all. And just a quick reminder to everyone, this Friday, we kick off the modifier boot camp. Due to, of course, certain dynamics with the Dallas location and of course, not many people available to attend live, we are still going to hold it. We know that it's an important event. So we're still going to hold this virtual. If you have not got your tickets yet and you're able to attend this Friday, or you want to just grab a ticket just to watch on demand, there's 3 CEUs. You'll be able to attend in the morning or afternoon. So you'll be able to attend live virtually from 9 to 12 or 1 to 4 this Friday. And we're going to cover all the modifiers you could really think of. We're going to hit hard telehealth. We're going to talk about specifically, again, we had planned live to talk about our state specific modifiers. So whenever we come to your city, if we get to come to your city, we will be picking out specific modifiers that are unique to your area, your state policies that you may not be aware of. A lot of times the revenue that we see, I'm sure you can attest this in California, there's a lot of different nuances with different payers that
Oh,
other states don't see, right? I mean, not to put you on the spot or anything, but are there any specific things that you deal with that don't happen in other states?
Medi-Cal. That's
Yep.
for number one. The
Yes.
Medi-Cal guidelines for our state, they're very complex because they follow their own stuff. I'm pretty sure they do it on every single state, but I think Medi-Cal for California is the worst. Honestly, it's so hard. I don't like them. I wish there wouldn't be existing policy guidelines. It would be just CMS guidelines. Would it be so much easier in a perfect world?
Oh, wouldn't it? I mean, I think
Yeah.
overall, when we talk to our providers and we do education, when I do compliance assessments, I'm always telling them, Medicare in many ways runs the show, and you'll be better off
Yes.
overall if you think like Medicare. Not going to lie.
Yes.
Just my personal opinion out there. I don't know if any of else feels that way. I just feel like if you follow Medicare, you're going to be good. If you follow
Yes.
their guidelines. And one of the things that was brought out recently, I think it was in the podcast that Sean Weiss had recently this week with Christine
Mhm.
and Terry, and there was Stephanie Allard on there as well.
Stephanie Muller, yeah.
Love all those people. So really just thinking about the fact that you have these payer policies, but when I was in the office, I was always thinking of, my job was just surgery practices. I didn't have to deal with some of the other nuances, but even then, I had a lot of providers on my plate. I got all my billing, all my coding done, and I was even able to help other practices because I was efficient. I knew what I needed to do, and I wasn't just a coder.
Yeah.
I knew that. I was also a biller. It was my responsibility to get my codes right, but also to make sure that my providers got paid. And I had to know where on the website it had the policies. And if you go on various policies, you need to look up their payment policies or modifier policies. They have most of
Yeah.
them very clearly, right? They tell you that they follow NCCI, right? Or they follow
Yep.
Medicare.
Mhm.
So
And
what are you
that's
going
very
to do?
simple. Yeah. Once you get that, and it is more easy. And then you go just to go back to you, because I was just having a discussion with my manager today about this. Then you also have to understand like your organization policies and procedures. Like if that organization follows CMS, then that's where you start going, you know, especially
Yes,
for the coding department. It's making more complex because we and the coding is hard to understand if you focus just on that department to do policies, because you are coding, you're not reviewing the claim. So if we follow at least to understand what the organization is doing, it will be so much easier. It is way easier just to follow the guidelines.
100%. It's so important. And I feel like there's just a lot of things that people don't think about that are affecting their everyday revenue. But that's not what we're here to talk about today, lady. We're here to talk about something even more important than
Yes.
revenue. Imagine that. Today is episode 9. We're talking about creating human connections. And ladies and gentlemen, I cannot think of anyone better right now in the industry in creating human connections than Laidy Martinez. So everyone is going to get an earful today on what I feel and what Laidy feels is important, why having a human connection is important. When I think of humanity in general, the term humanity, I think of people that care about other people, people that have the desire to be around other people. We were, in my opinion, solely my opinion, that we have this innate desire to be with other humans. I think, when you
Mhm.
look around, even the animal kingdom, right? I think about
Yeah.
how they kind of flock together and they stick to their kind, right? You know, maybe you have a puppy and they get along with a cat maybe in your house, but it's not natural for them. Like they see
Yeah.
another dog and they're like, "Oh," or like I have a dachshund, and when
Yes.
he sees another dachshund, he's like, "Whoa." So it's in us to be around our kind. And so
Yes.
I think that's why we love people so much and why we're in healthcare, right?
Right.
If you can think back, lady, to when you first entered healthcare, can you think of a feeling you had or maybe a desire why you entered healthcare? Was it because of that love for people, or was it something else that brought you in?
Actually, no, it was something like I was pregnant with my second son. I was pivoting for my, you're not gonna believe it. I was a delivery driver for DHL. Yeah. So like I don't say a lot, but
Wow.
yeah, I was a delivery driver. So I pivoted from that industry. And then my partner told me like, you need to do something better because you cannot be doing this job. Carrying boxes, delivering huge boxes, and then driving big, like it was like a 10-footer truck. So I was like, you cannot do this one. This job is not for you. And you're smart. And I was like, huh, he thinks I'm smart. That's good. So I went to school and I saw my sister-in-law doing medical billing, and I was like, you know what, that kind of is maybe good. So, but then I found very passionate because I end up loving it because I do primary care, and that's when you see geriatrics, and it was more like a Latino community. So I was able to help like more people like they were transitioned to be Medicare seniors. So I'm always feel like compassion for that because I always think about my parents. So I always thinking I want the best for my parents. So I wanted to be kind of that person that is supporting those people in that age. So I end up falling very in love with what I was doing. And then I always remind the people that was working with me because sometimes they were mean. And I see sometimes you doing so much in the front office, but I always tell people remind yourself, what are you doing it, the purpose, your why are you doing what you're doing? Are you just doing it to get a paycheck, or you doing it because it's rewarding to help others? So if it's just doing it for a paycheck, that's, you're in the wrong place. You're in the wrong place.
Ain't that
Because
the
for me,
truth?
it goes more than that. It has to be beyond that. You have to remember that when you're seeing and you're in the front line, you're impacting those patients. Sometimes they're already coming with a problem, and then you want to make it worse, or you want to make it easier for them.
Exactly. I love the way you think because I think it's the way most of us think. And I know we've all been into a medical office. I'm sure we all
Mhm.
have, where you go up to the front and you get a receptionist and she's on her phone, or she's distracted.
Yeah.
He or she,
Yeah.
and and then you're like trying to get their attention. You have to tap on the glass because they're not paying attention. And I actually had to train employees in the office that were
Yeah.
doing that, and it was very disheartening. And
Yeah.
you know, then they don't have all the answers, right? You don't aren't really happy to be there, and so it's hard
You can
because
see it.
and
Yeah.
we don't think of that maybe as impacting things, but when you think about how it impacts the physician, if a patient nowadays with social media, I mean, social media can make or break your practice. It can
Yes.
really send the wrong signals about what you're about. If your staff is not with it, your entire practice can be affected. So again, you can develop human relationships as, in that role. You can be that
Yeah.
person who really enjoys people, and the reason you take that job is because you have that skill. You're a people person. So you're going to be all about asking them how they're doing, even if they are in pain, which most of them are. You can do something that maybe doesn't add to their pain, like you said. And when the pandemic hit, I was no longer working in the office. I was already a consultant working for myself and
Hmm.
working remotely. So I didn't really have that um, you know, role where I was having to have the added layer of
Yes.
nuance with maybe having to do some virtual visits and things like that. I didn't really have to deal with that. But virtual was a very different dynamic. We still had, I think we had Zoom. I was already using it, I think, already for education here and there
Yeah.
for some of my classes, but it wasn't in your face like it is now. And when we think about education events we used to go to, the main reason I met a lot of the wonderful ladies and gentlemen that I met over the last few years was because of COVID. We were trying to find a way to still hold conferences and virtual events
Yeah.
so we can get CEUs, right, for our credentials. And so that's one of the reasons. That's how I met Kim Jolivet Williams. It's how I met Christine
Mhm.
Hall, Barbara Cabuzzi. It's how I met Terry Fletcher, and so many, and you as well. It's how I met you. So all these events we had, we just got connected that way. And
Yeah.
so in a way, it was a blessing in disguise for that reason, because we got to meet that pandemic wind down, and we're like, okay, we're going to have this around for a while. Just like the flu, just like any other disease, we're going to have this back and forth. We're going to have to stay inside if we're sick. We're going to have to think about how we approach, hygiene, washing our hands. We should already,
Exactly.
but
Hmm.
we think differently about life after this.
Yeah.
And so it's not going to go away necessarily, but we have to, at some point, think about what life was like before and how we can maybe, in some ways, not always, but some ways, get back to those human connections. Now,
I agree.
when you went to a virtual event versus an in-person event this past year, I know we both saw each other for the first time at Nashville Health Con, which is
Yes,
awesome.
it was wonderful. Oh my
Wonderful,
God,
wonderful.
that's so much fun.
So compare that, lady, to your experience with a virtual meeting. What was the difference to you? How did you feel?
I think the personal for me, for myself, personally speaking, I need to create that connect. I mean, I like to create connections virtual, right? It's like you're saying, it helps so much because then you can get to meet other people that they probably are on in the another around the nation or in another state and like on the other side of the world, probably, and that's great. It's good, right? But I also need that personal touch. I need that just more interaction. I need to see the person. I need to see the the facial expression, the body language, but in person, real life, in order for me to feel that. And then, sometimes there are things that you can see on Zoom, but you sometimes, a lot of people don't even share like their videos. They, most of the time you're just talking to a black box, and then you're like, okay, so I don't see who's there, who's behind that person, who's behind the box. So for me, it is important to see the person. And then sometimes I don't even like to testing messages. You can ask Kimberly. Kimberly and I, we spend hours and hours talking on the phone, and like, seriously, sometimes I can't even tell. Sorry, Kim. We go until 1 in the morning to talking, and we don't ever get tired. And that's it's just that I don't like to be testing. I hate it. I'm like a very old fashioned person. I mean, I'm a millennium, but I still like, I feel like I'm old fashioned way.
Well, I'm glad to hear you say you're millennial because I am too. And I'm at the very beginning, like when it
Me too.
started. And so my husband is like right before me. And I'm like, so it's funny, like we think about millennials, like they go a little further than we might think. And so they they grew up in a world that's very different than ours, even though we
Yes.
are in the same generation, which is
I'm
so
like
funny.
almost on the last one too.
Yeah, it's right there. So I mean, we remember having phones in our wall, and we remember what it's like not having cell phones, not having social media, obviously. And
Mhm.
speaking of social media, I feel like there is a lot we can blame on it, a lot of benefits to it. And
Yes.
recently I decided to just get out. We all kind of use it differently. But over the years, with different platforms we've used, some are more personal, some are more really for business, and others are just for, I guess, whatever, news, what's going on. But there's a lot of negativity out there. So we really need to start thinking about how we portray ourselves. And in the business world,
Oh,
you may not
yes.
realize this, but what you put out there on social media tells the world a lot about you. And
Yes.
very difficult for you to make a human connection if you can't portray the real you, even on social media. So I've always been me. I've never changed who I am. I'm very transparent about how I feel about things. I'm very passionate about what I do, and I'm not fake whatsoever.
Yes.
And
And that's the best way.
I can
Yes.
tell right away if someone doesn't respond to me. I'll give you an example. So I want to ask you some of your personal experiences you've had at in-person events, but recently I went to an event, and I realized that not everyone knows me or who I am, but I'm just a person that walks up to people, and I'm just very interactive, and I like to have
You are.
conversations, and not everyone is that way. And so I learned that even at in-person events, you do have to somehow, find a good way for you to interact with people. Because I walk up to a group of people and they were like standing there, and I was trying to interact with them and it wasn't happening. So I was like, okay, I'm going to find some more people that I can interact with. So
Oh,
even at in-person events, it can be a challenge.
it is.
So when you go to a personal in-person event, Lady, what are some of the things you try to do to network? What's a good thing that you do?
Oh, that's a great question. So I'm very talkative. Like, and I'm not scared to talk. I could be in a table with no people that don't know me, and I could just say, "Hey, how you doing? Hey," like I'm just very talkative. Like I don't care who's there, who you are. Like remember when we met, like Jennifer, and it was the best moment. I'm seriously, I was waiting for the moment. So I was I like to make it very approachable and making more conversations. Say like, "Hey, are you enjoying the day? Are you enjoying your time? Where are you coming from?" So I like to ask a lot of questions. So, and I was very surprised when I was in Helcon that I didn't know a lot of people knew who I was. I didn't know. And I was like, they were like, "Oh my God, you're Laidy Martinez. I will love your motivation post." And I was like, I was very surprised, honestly. It surprised me. It got me off guard because a lot of people, yes, I follow you on LinkedIn and they always were giving me great feedback. And I was like, oh my God, this is so, at first I couldn't understand what was happening, and then Christine Hall came and she's like, "You're famous," and I was like, "No, I'm not." It was a very good moment, but I enjoy it. I enjoy it very much. That I feel like I was making an impact. That whatever I post, and it means something to me. I want to make feel someone seen, and then that's what I one of the main things that I do when I before we talk about what I do with my chapter, right? So that's one of the number one things that I do. I want to make sure that whoever comes to our social or events, whether there's a seminar or our monthly meeting. I want every single person to be seen. I want them to know that we are doing this for you. We just don't want to provide CEUs. We want to provide education. And I always tell people and remind them, and this is what I said, like on our meeting just recently, a week ago. And I said they were asking me about the CEUs, and I said, look, you want to be careful when you ask for CEUs. It's good to have a CEU, but you want to make sure you are going to an event for the education. That should be your number one reason, not the CEU. The CEU is like the cherry on the top, but it's not the main thing.
100%. And that's, I mean, we've all been shouting that from the rooftops. There'll always be people out there that go just for that because
I
that's
hate
all they
them.
know. And when I think about when I try to educate people, I'm like, there's so much more. Not that coding is not a great career, but there's
Mm-mm.
so much more to healthcare than coding.
Yep,
And
it's bigger.
I'm at the end of my journey with coding personally. I've gone as far as I can go personally with it after 20 years. And so I've moved on from that love I have for coding. I do love it, but in my personal life, I've experienced things, and it's led me down a path I didn't think I'd go down. And this recently, I was talking to people about it. I've had some interactions with different ones at conferences and even virtually, and it made me realize where my true passion is now. So, one of the things about going to in person events and networking with people in a real way is that you kind of find out a lot about yourself and you kind of
Yes.
learn who you are when you are around other people. It wasn't until I met Christine Hall in person, and when I got to go out to California and have a glass of wine with Terry Fletcher. I mean, like, who gets to do that stuff? I mean, I was just so
Exactly.
amazed that I got to have that human interaction with someone I have been such an admirer of for so many years. And I'm telling you, people like
Yes.
Christine and Terry Fletcher, they are so approachable. They are the nicest, most human people you ever meet. And they truly, truly want to help everyone
Oh,
when
yes. Yeah.
when they can, of course, when they can. We don't want to take advantage of
And
them, but but they're great
yeah, no,
people.
and that is good. That's a good thing that you approach, because one of the things that I like, and you mentioned Terry, and Terry, I love Terry the way she is. I like her authenticity and how transparent she is. You know, she's straightforward. She says it how she is, regardless, and I love that about her. I met her like a when I first become a coder in 2019. I attend to one of her seminars that she did before the pandemic, and then so I kind of follow her. I listen to her podcast all the time. Whenever I have something in it, I listen to her podcast, and I'm being more active and listening to the compliance guy, because now I'm getting more into compliance than othering. So, and it helps. It helps that you make those connections. I met Christine Ho in person right before, a little bit before HealthCon. We went for dinner too, and then I was like the same way as you were with Terry. I was like, my God, I'm having a dinner with Christine Hall. I mean, with Christine Hall. And then it was, she's so humble. She's so like down to earth. And you see her like speaking like a keynote person. And you're like, oh my God, this is so nice. It makes me feel like so good. And then we create I honestly don't call them any more connections, neither you. I call them more friends, because that's what you guys are. And then but as a friend, I'm also mindful, because you guys and that's one of the things that I want to remind, because Terry mentioned this yesterday. You also have to be careful, because when you connect those connections, you don't want to always constantly asking like taking out of their time, because you have to be mindful with that. You are, as a
Mhm.
consultant, you are a consultant, Terry's a consultant, and a lot of my friends are consultants, and you have to be careful and be mindful of their time, because not just
Absolutely.
don't take advantage of the friendship, but don't take advantage of that. And that's when it comes that you value that person, you connect with the person, not because of what the person is or what the person does, but because of who the person is personally. And that's the way I see it. And I am like that with all my friends, and I'm there too. And it's a interchangeable, like, it's a two-way street
Mhm.
connection. That's how I see
Absolutely.
it.
Beautiful, beautiful thoughts, lady. I'm so glad you said that because, I'm not going to lie. I'm going to be real. It's my podcast. I'm going to get out there and say it. Sometimes I personally also feel taken advantage of by
Mhm.
some. It's not that they intend to do it. I just feel like I wish there was more education out there available to those that are working in these hospitals and practices, because by not educating them, you are, no offense, you're taking money away from us and
Yes.
time away from us that we could be spending, you know, making money for our own families. And so please, please think about that. If you are out there in a facility and you feel that your employees need training, are you asking for training? First of all, I mean, is something wrong with it? If you work for a facility or hospital and you feel like you need training, there is nothing wrong with asking for that.
No.
And again, you need to also be responsible for your own education. So we are
Oh,
professionals.
I couldn't agree. Oh my God, totally agree with that. I always tell people, my friends, even coders or colleagues, or fellow coders, or even the members from my chapter, it is okay to ask a question, and if you need guidance, right? But I was like, do not expect to get the answer. Expect to give guidance and resources, because it's easy for me to give you the answer, but what are you getting out of it? What are you learning at? Like, you need to kind of do your research. I can guide you to the answer, but I don't want to give you the answer, because then I'm not doing no service to you. And that's what I tell my coworkers. I can give you the resource, and then you can take it from there. Now, if you still need help, we can discuss it, and we can get to the common ground, and we can find the right answer. So it's easier, it's better. And then I seen a lot of people sometimes post on Facebook, what is the answer for this question? And or like they're studying for, I don't like that. I mean, I don't understand that sometimes.
No, I don't, I don't understand either. I was in a position where I was hired to do a job. I was certified, and I really did kind of learn as I went. I didn't know all the answers, but I knew where to go for the answers. I was, always well trained as a biller, where to go, the
Exactly.
manuals, where to go for that. And they're out there, but a lot of people are misled when they go into this field into thinking that they, you know, are going to have all the answers and that this is just all they have to do, and then they get into the working world and it's a lot more than just coding. It's a lot more than billing. There's a lot to it. So
Yeah.
they get overwhelmed and they don't know where to turn, and they maybe feel embarrassed. They should have known this already. And it's not that you don't automatically walk into a job knowing everything, but do you have the right attitude towards finding the information? And there are people that are out there willing to help you find the answers, but again, think about how you approach your own journey as a professional and be professional about it.
Yes.
Now, going back to just talking about making human connections, one of the things I want to kind of transition into is the benefits of virtual and how they lead into your desire to meet people in person, because I think that's important that we still have virtual education. There are a lot of benefits to
Yes.
it when
Mhm.
there are people in rural areas who need education that can't get
Yes.
to an event, but those, when you meet people like that and you go to an event and they are there, make sure you make that human connection with them. Recently, or at HealthCon, actually, I met Maya Turner for the first time.
Remember, I
And
introduced it to you.
I know, I was like, wow, I've been wanting to meet her for a very long time. And so I was a fan of hers, didn't know she was a fan of mine. I'm like, what?
Oh my God,
It was so
the video.
amazing. And now, yeah, I love it. The video was great. And then, like, we text all the time, and she's always checking on me to see
She's
how I'm doing.
amazing.
She's a great
She's
person.
amazing. Yeah, she's a
When I
great
was in
person.
Chicago, right? And visiting my family, and she checked on me to see how I was doing, how my father-in-law was doing. And it was
She
just,
has such a vibe, such an amazing spirit. I couldn't agree with you with since I met her. Like, I saw her presenting her Modifier 25, I believe, and then, oh my God, I was like, wow, wow,
I love
speechless.
it.
Like,
I love
yeah,
it. Well, lady, this is so great that we get to actually, this is what it's about. We're having a human connection right now. And guess what? We are connecting other people to other humans who we
mhm,
respect.
yeah,
And I hope that all the shout outs today to all the people that we love makes them
yes,
feel good, because all of you that we mentioned today are valuable to so many people. And we're so happy that you do what you do that inspires us. And now we get the opportunity to inspire you and others. So we hope
yes.
that it's a great connection we can make. So I will be at the upcoming NAMUS conference in Charleston on December 7th and 8th. And I will be speaking with Miss Christine Hall, double session.
Oh
We're
my
going to
God,
be
the
collaborating again.
duo.
I know, right? I can't wait.
You guys
So
are
that's
the
going to be
main, the
fun.
best duo.
we just have so much fun together. We were just
Yes,
talking
you
about
guys
it today,
do.
actually, and we're just talking about how much we love just feeding off of each other's energy. So
I know. I work with Christine Hall directly with the APC, and then for I'm her TA, and I just love her. Our relationship has grown so much. It's like no longer more like a connection; it's a friendship, like I mentioned before. But I love her. I love her.
same, same. Well, everyone, we have one more reminder for you for just an upcoming event. We did have to postpone our practice management symposium, but it's not canceled, guys. It is still happening. So our practice management symposium has been moved to February 16th, 2024. And we have a very special treat. We have a compliance panel picked out for everyone at the conference. So again, attending the full day gets you 8 CEUs. You can scan the QR code on your screen. So you can, of course, buy your tickets to that. But there will be a compliance panel at 1 p.m. Central with myself, Christine Hall, and the amazing Susan Wahlberg. And I got to meet Susan virtually last year or earlier this year. She was on a podcast with me. I got to interview her on a podcast about her book. Now, this
Wow.
lady, this woman is amazing. She's a lawyer, but she has compliance experience in hospitals and clinics, and she decided to go
That's
to law
amazing.
school. And I'm
Wow.
like, how fabulous to have that idea to go back to law school. So now she's just one of those amazing people that has a unique perspective on healthcare, on compliance, because of going through law school and then understanding the legal field and how compliance intersects. So we're going to give away actually a couple copies of her book, her compliance book for physician practices at the conference. And then later tonight, guys, at 6:30 Central, I'm going to be presenting on compliance and ethics. So
Wow.
if you have the time and you want to attend, that's a couple hours from now. You can go. You can scan the QR code. It'll take you to our Eventbrite page, and then you can actually locate our upcoming events there directly. So scan the QR code for this conference. It'll take you to Eventbrite, and then you can actually find our upcoming events, and you'll see the one for this evening. And we hope that you'll attend that as well. You can also see it on our LinkedIn page. It's also there as well. So we hope you'll attend that if you can. It'll be on demand again, and we'll have an opportunity to give away one of her books there as well. We really want to focus on compliance, and we want to focus on how we can help each other be compliant, in general. It's about being ethical people. And, the difference between ethics and compliance will be explained in tonight's session. So we hope that you can understand why we need to be ethical and how that trickles into our compliance standards that we uphold. So I think that all practices should try to attend if they can, or individuals who are interested, because we all have a role, we all have a responsibility to
Yes.
compliance.
Yes. Every person that does touch anyone in healthcare, they need to kind of like have a little bit of one-on-one compliance, right? I agree
Exactly,
with that.
exactly. If you're listening on demand to this podcast, you can, of course, go to Spotify and find us on Spotify. And you can find the live video version of this podcast. We will also post it all over social. You can find us on Facebook, Instagram, X, and TikTok. So find us everywhere you can find social media. We also, of course, are on YouTube. So find our YouTube channel. We are so excited to share that with you. Please keep connected with us. Make a human
Oh, yes.
connection with somebody today. When you leave your house this evening to dinner, or tomorrow when you go out to the office, or you go out to Walmart or wherever store you go to, whenever you go out, try to make a human connection. Try to smile at someone, make someone's day better. Ask someone how they're doing. Just find somebody you can do that with, and it'll make all the difference to them. I promise you. The more human connections we make, I think the more we're going to feel more comfortable reinventing society as we know it. So I think it's a great idea to have. So Laidy, I look forward to seeing you at HealthCon, and then of course in Orange County in April. So thank you
You
again for
sure
coming
will
on the
see me?
show. Thank
No,
you
thank
so
you for
much.
inviting me. And thank you for inviting me. And just to wrap it up, I just wanted to say, like, uh, for a like you're saying, go back and to talk to people. Be authentic. Be yourself. Don't try to copy anyone. You are you, and the world needs you. So just by yourself, you just be yourself.
Exactly. That's all it ever asks for. It's all you can do, right? You can't be somebody else. I can't be a lady. And
No.
Laidy can't be a Jennifer. I don't think you'd want
Yeah.
to, but
And we
but
are
yeah.
we are we are unique in our own
Mhm.
way, and then it's okay. You once you kind of love yourself. You have to love yourself, love who you are, love what you do, and then the world will love you too. And if they don't,
Exactly.
it's okay.
It is. It's perfectly fine. Well, thank
Yeah.
you, Lady, for joining us. And thank you to our wonderful audience for always tuning into the Healthcare Inspired podcast. We will see you next week for another episode on tech and AI. So stay tuned.
Don't miss